everyone. My name is Sheena Yap Chan. I'm super excited to be here today. Today, I'll be talking about confidence and visibility. For those of you who may or may not know me, I am a keynote speaker, Wall Street Journal bestselling author, podcaster, consultant on confidence and visibility. And so today, my topic is the confidence to thrive, reclaiming voice and visibility in diabetes care and advocacy. So I hope you'll enjoy it. And I hope you've enjoyed the rest of the talks at this conference. So let's get started. All right, let me just have this on full screen so we can start the presentation. So, the confidence to thrive, reclaiming voice and visibility in diabetes care and advocacy. Why this conversation matters? Representation is not optional, it's transformative. When people see leaders, providers, and advocates who reflect their identity and lived experience, they feel seen, validated, and empowered. Without representation, silence and self-doubt grow. Diabetes care is shaped by more than medicine. Managing diabetes isn't just about glucose numbers or prescriptions, it's also about navigating invisible forces that affect confidence, access, and outcome. Cultural barriers. Some cultures discourage speaking openly about illness. Expectations of silence or enduring quietly can keep people from asking for help. Systematic bias. Women and BIPOC individuals are more likely to be dismissed, misdiagnosed, or excluded from clinical trials. Healthcare systems often fail to account for cultural nuance in care delivery. Shame and stigma. Diabetes is too often framed as your fault instead of a condition shaped by genetics, environment, and access. Shame reduces confidence and prevents people from seeking timely care or support. Now, I know sometimes shame plays a huge role. I know in our culture, especially for Asian women, everything we do, we have to always make sure we're not shaming the family name, shaming our culture, shaming anybody else, and it can take a huge toll on us. So if you've ever felt that way, you're not the only one. It really does affect a person's confidence. Who speaks up, who gets heard, and who leads makes a difference. A confident patient is more likely to advocate for the right care. A visible advocate can shift cultural narratives. A leader with lived experience can transform systems from within. This is why voice, visibility, and representation in diabetes care aren't just nice to have, they're essential for equitable, effective care. So here's some silent barriers in diabetes care. You've probably experienced it yourself. For women in BIPOC communities, the barriers are often invisible but deeply felt. So the first one, misdiagnosis or delayed diagnosis. Symptoms may be dismissed or minimized, especially in women and people of color. Stereotypes such as diabetes as a lifestyle disease can lead to assumptions instead of listening. Results, later diagnosis, more complications, and feelings of mistrust towards the healthcare system. Next, limited access to culturally competent care. Providers may not understand cultural food practices, traditions, or beliefs around health. Language barriers and lack of translated materials can limit understanding. Patients may feel like outsiders in their own care plans. Shame, silence, and stigma. In some families and communities, illness is seen as a weakness or personal failure. Diabetes stigma, blame, judgment, and secrecy can prevent people from seeking support. Silence becomes a coping mechanism, but it also deepens isolation. So, impact, reduce confidence in advocating for needs. Patients may hesitate to ask questions or challenge providers. Fear of judgment keeps them from disclosing struggles or seeking second opinions. Confidence erodes, leaving people to quietly manage instead of receiving full supportive care. When barriers remain unspoken, they reinforce inequity. Naming them is the first step to dismantling them. So these are so important to bring out because it's probably not talked about enough, and it's really important to know what barriers we're dealing with so that we can find solutions to them. If some of you have felt this, just know you're not the only one. It's probably more common than we realize. It's just, again, we don't talk about it, right? So I hope some of these we can start finding ways to have solutions so that it's a win-win situation for everybody. Confidence as a health intervention. Confidence isn't just a nice to have, it's a health intervention in itself. When people believe in their voice and worth, they are more likely to access care, challenge bias, and shape healthier outcomes. Confidence influences every step of the care journey. Seeking diagnosis. A confident person is more likely to recognize symptoms as valid, insist on testing, and not dismiss their own health concerns. Without confidence, people may internalize dismissal, maybe it's just stress, and delay critical care. Navigating healthcare systems, confidence helps patients ask questions, request second opinions, and push past bureaucratic barriers. It shifts people from passive recipient of care to active partner in care. I think this is also important, especially when it comes to having a second opinion, third opinion. I've always liked to ask questions. I always like to make sure that whatever I'm going through, I can ask two or three different, health professionals to know that, it's on point what's going on. And there's no shame in asking questions. There's no shame in asking for a second opinion. I think it's important more than now. And if a health professional doesn't like that, this is also about your health. So it's really important to be okay with that, being able to ask for a second opinion, being able to ask the right questions so that we can have win-win situations. Advocating for fair treatment. Confidence makes it easier to speak up when care feels rushed, biased, or incomplete. It equips people to say, I deserve to be heard and treated with respect. Leading in community spaces. Confidence isn't only about personal health, it ripples outward. Those who gain self-trust often become peer supporters, mentors, or advocates, inspiring others to speak up too. Confidence isn't arrogance. Arrogance closes doors, confidence opens them. At its core, confidence is self trust plus visibility. Self trust, believing your experience matters. I think, sometimes we don't trust ourselves, especially as women, we've not always been taught to trust our intuition, to trust, what we think. But it is important to do that because we're more capable than we realize, and our experiences matter as well. Visibility, but being willing to be seen even in spaces where you once felt invisible. This is so important. All the work that I've done really starts from my own upbringing. I always felt like I don't never felt seen. I moved from the Philippines to Toronto when I was 7. So it was a huge culture shock for me. I've never seen so many different cultures before. And even though Toronto is one of the most multicultural cities in the world, it wasn't really represented in the media. So, I always felt ashamed of being Asian. I didn't want to have, the features that I have today. I wanted to have blonde hair and blue eyes to feel beautiful, to feel accepted. And so for me, I never wanted anyone else to go through what I went through. And this is why representation matters, being visible matters, showing up matters, and why I do these talks. Because I want people to see what's possible for themselves and not feel invisible at the same time. So, um, when we treat when we treat confidence as a health tool, we unlock better care, stronger advocacy, and more inclusive leadership. So here's lessons from 800 plus conversations with women leaders. So 10 years ago, I started a podcast called The Tao of Self-Confidence, where I've interviewed over 800 women on the topic of confidence. And the reason why I did that was because I was dealing with a lot of my own confidence issues. And I was really seeking resources that also catered to Asian women, but of course there wasn't any. And so I felt like I was the only one dealing with these problems, not realizing a lot of women were, it's just we never talk about it. And so I said, you know what, I'm going to just start it as a way to create better representation and also and also provide support. And so across interviews with women leaders worldwide, a clear truth emerged. Confidence is not something you're born with, it's something you build, and those lessons translate directly into diabetes care and advocacy. So here's some common themes. Confidence is built, not given. No one wakes up fearless. Confidence is a muscle. It strengthens with practice, community, and action. Women describe small acts of courage, asking a question in a meeting, challenging bias in a room, as the stepping stones to greater leadership. I think for me, that's also important. You don't have to take big leaps to build confidence, build courage. It's actually those small, daily, actionable steps that yield the great results. In diabetes care, every question asked, every story shared, every appointment where you advocate for yourself builds that muscle too. Visibility matters. Seeing yourself in leadership sparks change. Representation creates possibility. When women see others who look like them in positions of influence, it affirms, I can do this too. Leaders become role models not just for skill, but for identity and belonging. In diabetes care, seeing BIPOC women and underrepresented voices as doctors, researchers, advocates, or community leaders builds trust and breaks stigma. Storytelling is a tool for breaking silence. Leaders around the world shared how telling their personal stories built bridges, reduced isolation, and gave others permission to speak. Stories create community. They transform private struggles into shared strength. In diabetes care, storytelling destigmatizes chronic illness, challenges blame, and shows that people are more than their diagnosis. I think storytelling is so important, especially, I've spoken to a lot of women where they feel like their story doesn't matter, but your story matters a lot more than you realize. And you never know whose life you can change by just sharing your story out there. And I just want to encourage each and every one of you to be okay to share your story, the struggles you went to, how you were able to overcome them to get to where you are today, because that could actually change a person's life once they hear it. And I know sometimes it's scary, but the more you keep doing it, the better you get at it, and it also helps you build confidence. And being able to interview over 800 women, I've been lucky to hear 800 different stories of how women were able to forge their own path, overcome obstacles, and thrive. And I love it because I realized that I was not alone in this journey. It's just nobody ever talked about it, or nobody ever created a platform where women can talk about their stories. So this is why I started my podcast, The Tao of Self-Confidence. Diabetes care needs lessons too. These lessons too. Building confidence strengthens patient voice. Visibility opens doors to inclusive leadership. Storytelling dismantles stigma and cultural silence. Leadership lessons aren't confined to boardrooms, they're vital in clinics, communities, and care systems too. The power of representation. Representation is more than symbolic, it directly impacts health outcomes. When people see themselves reflected in their providers, advocates, and leaders, it changes how they experience care and how confidently they engage with it. So for me, representation matters every single day because it shows others what's possible. It can, create new opportunities, break barriers, and change the way we see things. When patients see providers, advocates, and leaders who look like them, the trust deepens. Shared identity or lived experience reduces fear of being misunderstood. Patients are more willing to disclose struggles, ask questions, and follow through with care. Trust is the foundation of effective treatment. Stigma reduces. Seeing leaders and peers openly living with diabetes normalizes the condition. Visibility challenges the idea that illness is shameful or hidden. Patients feel less isolated, less blame, and more supported. Self-advocacy increases. Representation signals your voice belongs here too. Patients are more likely to push for fair treatment, demand clarity, and engage as partners in their own care. Confidence grows when people don't feel alone. And I think this is so important. Sometimes we feel like we're the only ones dealing with this, and sometimes we feel like we're too afraid to ask for help or be part of a community. But I mean, you're here for a reason because you also want to be part of a community. You want to network, you want to meet new people, and you don't have to be in this journey alone, right? This is, there's resources, there's events for this purpose, so you don't have to feel alone. There's other people out there who might be going through similar situations as you. So representation is better outcomes. Studies show that patient-provider racial concordance can improve communication, adherence, and even clinical results. Diverse leadership ensures that policies, programs, and innovations reflect the realities of all communities. Representation isn't about fairness, it's about better health for everyone, right? We want to make sure that everybody wins, right? Especially living in North America, there's so many people from different parts of the world that migrate here to have a better life. And it's a huge melting pot. And so it's important to be represented that it be represented in our leaders, in the health professionals, so that they can understand, what we go through, there's no communication barrier, there's no misunderstanding, and it's a win-win situation for all of us. When representation is missing, patients carry the extra burden of bridging the gap themselves. When representation is present, that burden lifts and care improves. So now we're going to talk about the Visible framework, which is a pathway to confidence and advocacy. So, Visible is a framework for building the confidence to thrive in diabetes care and advocacy. It's not about perfection, it's about practice. Each step strengthens voice, visibility, and leadership. So this is a framework that I created. It it's included inner and outer work to really build the confidence and be where you are today. And so each letter represents something in the word visible. So here they are: voice, identity. Well, V for voice, I for identity, S for spotlight, I for inner work, B for belief, L for leverage, and E for elevation. And I'll go through each of that in the next slides. So, voice. Speak your truth without apology. Use your voice to ask questions, challenge assumptions, and share your story, and also share ideas. I've spoken to a lot of women who are always afraid to put their hand up, share ideas in a business meeting because they're afraid that their idea might be stupid or they might get rejected. And so they don't realize when they're in the meeting, the person beside them shared the same exact idea that they had, and he was praised for it. And so it's really important to speak up. And even if your idea does get rejected, I think it's better to share that idea, get rejected, than to not share it at all and then keep wondering, what if I did, what if I didn't? So don't be afraid to speak up. Nothing happens if nothing happens, right? There's no change unless you speak up. And you can start small. Identity. Own who you are, your culture, history, and lived experience matter. Identity is power, not something to hide. I think sometimes we feel out of place, especially when, we come from a different country. We feel like being different it is a handicap when really that could be our greatest strength. Having our lived experiences, how we're brought up, the history, it's all important. So own who you are, your culture, history, and live experience, of course. And identity is power. It's not something to hide. So I never want you to hide who you are, what you can offer to the table, because it is important. It's 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 your difference that really helps you stand out and be the person that you are today, or the leader that you're meant to be. Spotlight. Step into spaces where your voice can be heard. Whether it's a doctor's office, a support group, or a public stage, visibility changes narrative. So don't be afraid to be in the spotlight. I know as women, we're not taught to always be in the spotlight. We're taught to be humble, stay in the background, never make any noise, but that doesn't help us because then we don't have representation. And for me, it is important to step in that spotlight. One of my books is called Bridging the Confidence Gap. And one of the reasons why I wrote that book was because there was a report from the World Economic Forum that mentioned that total gender parity would be achieved at the earliest in the year 2154. 2154. I said 2154. So I said that three times. And so when you think about it, that's like less than 130 years from now. But unfortunately, that's when I wrote the book, which was last summer and like last summer of 2024, and now it's actually delayed 4 more years. So now it's 2158. So that's about 133 years from now, and I don't think anybody wants to wait that long. That when we think about it, that's probably about 5 more generations at least before we see total gender parity. And this is why, as women, being in the spotlight matters because it changes the narrative, it breaks barriers, it creates new history, it opens the doors for so many other women to go out there and do amazing things. And I'm sure no one wants to wait 133 years for gender parity to be achieved. So don't be afraid to put yourself in the spotlight. Inner work. Build resilience through reflection and self-compassion. Reframe limiting beliefs. Replace I am a burden with I deserve care and respect. Having that inner work is so important. It really starts with that. It's the foundation. And so, going through, the feelings that we have, the traumas that we have to work through, we need to work through that so we can show up as our best self. Belief. Trust in your worthiness as a patient, advocate, and leader. Belief is the foundation for advocacy. It fuels persistence when systems push back. I know you probably heard so many times to believe in yourself, believe in yourself, believe in yourself. But it is true. It is important to have that belief because without that belief, you're not going to go out there to be the best advocate, the best leader that you can be. And so being having that belief is just having that inner knowing that you're going to make it happen regardless of the outcome. Even if you have no clue what you're going to do, you just know you'll figure it out and you will get there. So have that belief because it really is that starting point to your journey. Leverage. Use your strengths, network, and live experience to drive change. Even small influence, a conversation, a social post, a peer connection creates ripple effects. So being at this conference, you're going to meet new people, being able to network with them. You never know. Sometimes you're just one connection away from your opportunities. Oh, yeah. So don't be afraid to leverage your network. Elevation. Confidence multiplies when shared. Mentor others, amplify underrepresented voices, and create space for new leaders. I think this is so important. I know sometimes we feel like there's only one spot in the top, when really there's more than enough out for us to be at the top. And the more we can elevate ourselves and each other, that's how we grow. That's how we can, you know, create different opportunities, create different solutions, and really have better healthcare for every single one of us. Visible is a personal practice and a community blueprint. It helps individuals reclaim voice and visibility while ensuring no one rises alone. The most important is that you don't have to do this alone. We're here doing this together. Like I mentioned, you're at this conference for a reason because you know you don't want to do this alone. You want to meet new people, you want to seek resources, you want to seek support so that you can show up better as a leader, as an advocate, and as a patient. So I hope you enjoyed the visible framework. So now, creating safe and empowering environments. Confidence grows in environments that feel safe, inclusive, and respectful. Providers and caregivers have a powerful role in shaping those environments. For providers and caregivers, listen before you advise. Patients want to be heard, not rushed. Take time to understand their lived experience, how culture, family, and personal history shape how they manage diabetes. Active listening builds trust and reduces the power imbalance between provider and patient. Ask culturally aware questions. Go beyond the medical checklist. Ask, what foods are part of your daily life? Are there cultural or family expectations that affect your care? This avoids assumptions and opens dialogue. Cultural awareness is better adherence and more realistic care plans. Validate patient voices. Acknowledge concerns even if you don't have immediate solutions. Simple affirmations like, that sounds challenging, or I hear you, can make patients feel seen. Validation transforms shame into self-trust. Co-create care plans. Shift from prescribing to patients to building with patients. Ask, what feels realistic for you, or what support would help you succeed? Collaboration increases buy-in, collaboration increases buy-in, confidence, and long-term outcomes. When patients feel safe, respected, and included, they don't just follow care plans, they own them. That ownership is where confidence and advocacy thrive. So here's some key takeaways that we got from this talk. So number one, confidence and cultural norms shape diabetes care. Confidence isn't a personal trait, it's a critical health factor. Cultural norms around silence, deference, and shame directly affect whether people seek care, trust providers, or advocate for themselves. Supporting confidence means acknowledging cultural context, not ignoring it. Number two, safe environments are essential for advocacy. Patients won't speak up if they feel judged, rushed, or dismissed. Providers and caregivers can build safety by listening deeply, validating experiences, and co-creating solutions. Safety unlocks voice, voice unlocks better health. I think having safe environments is really important. Having psychological safety, um, having that can mean the world to, a patient, an advocate, and a leader. Leadership and representation drive inclusive change. Seeing women, BIPOC leaders, and lived experience advocates in decision-making roles transform systems. Representation breaks stereotypes, build trust, and ensures care reflects the realities of diverse communities. Inclusive leadership isn't symbolic, it changes outcome. So I hope seeing this helps, because leadership and representation really is important, especially where, if you've grown up not having that representation, it can really hurt a person's confidence. And so for me, I've always had a mission to always have better representation, to be visible, because it's not just about myself, it's for every single other person out there who's gone through similar situations, and just show them that if one person is doing it, it's possible for themselves. Storytelling is a tool for breaking stigma and silence. Stories humanize diabetes beyond numbers and labels. Sharing lived experiences reduces shame, builds community, and creates cultural permission to speak openly. Storytelling is advocacy, storytelling is leadership. So, again, your story does matter. Don't feel like your story isn't important. It really is important, because you never know whose life you will change just by sharing your story. So, I want you to be able to start sharing as many stories as you can, even have a book where you can just write all the stories that you could think of, right? That could be beneficial, that can help someone out there, because your story does matter. And I like to repeat it to let you know that it does matter. And so start even sharing it today with maybe one of the attendees here, or sending an email to the organizers sharing your story, whatever that looks like, right? Start practicing sharing your story out there. So, here's some last words for individuals. Believe in your voice. Believe it. I know it's easier said than done. It takes a lot of practice. It can be scary, but you got to start somewhere. And the more you keep doing it, the better you will get at it. When I first started, it was also very nerve-wracking for me. I never thought people would believe me, or they thought I was going through something, but I just started, and it started small, and I just kept building up on it until I was able to speak on stages and do presentations like this. So believe in your voice, because once you believe in it, you become unstoppable. For providers, make space for voices that go unheard. This is so important. Sometimes, there's people out there who want to be heard, who want to share their voice, but are a little bit too shy or a bit of an introvert. And so creating that space can mean the world to them. And, it could be many different ways. Maybe having a suggestion box, or just having a little meeting or a one-on-one talk. That can go a long, long way. And for advocates, lead with visibility and inclusivity. So this is really important. Like I mentioned, living in North America, we're a huge melting pot. And it is important to have, leaders, advocates, patients represented properly, that we all work together and have better healthcare for each and every one of us. Together, we build a future where every voice in diabetes care matters. And so that was the end of the presentation. If you like, you can connect with me by scanning this barcode. All my social media will be there, my websites, my books, other resources to help you build more visibility and be seen and have more confidence. And so I hope you enjoyed today's presentation. So again, my name is Sheena Yap Chan. I'm a keynote speaker, Wall Street Journal bestselling author, consultant, podcaster on confidence and visibility. And I hope you enjoyed today's presentation, and that you're able to walk away with something that can help you in your own journey. So I'm going to stop sharing the screen. And I hope you enjoy the rest of the conference. I hope you enjoy the rest of the talks. And again, thank you so much for taking the time to listen to my presentation. And I hope you have an amazing day. And feel free to reach out to me. Like I mentioned, I just gave my code, my barcode, so that you can connect with me. So have a great one. Bye for now.